Welcome back to The Price of Business. I am your host, Kevin Price, talking to you about you and your business. Of course, Obamacare is a big deal. People trying to figure out what it all means, what's going on with it. And there's a lot of companies out there who are trying to help companies navigate through it. Thomas D Johnston, CEO for Employer Direct Healthcare, is based in Austin, Texas. And Thomas, welcome to the program.
Thank you very much, Kevin. Appreciate you having me on.
You bet. Kind of give us a macro overview of what your company is all about.
So what Employer Direct Healthcare does is provide a supplemental benefit for self-funded, usually large self-funded employers, where we direct planned medical procedures to our narrow network of high-quality providers, and we do that at a transparent bundled case rate. And so what we're trying to do is two things with our offering. One, have transparency in the quality of the providers and transparency in the cost, which is, in today's market, very difficult to find.
Mm-hmm. You've given that elevator speech before, haven't you?
Yeah, I think so.
Yeah, sounds like a very good job. So tell me, so basically you work a lot, I'm assuming, with larger businesses, at least 100 employees plus.
Yeah, and usually even more than that. Our average is about 13,000.
Your average
members.
is around 13,000?
Yeah, that's exactly.
So
13,000 members.
Small cities are your average.
Pardon me?
I said small cities are your average.
Yeah, you're right. It's hard to believe. The funny thing is that about 150 million lives are under self-funded employers. So almost half of the country is under a self-funded employer. So there are a lot of lives and a lot of large companies out there, looking for these types of benefits where we can actually cut their costs.
And I'm assuming what you're looking at are packages that have self-funding up to a certain amount, maybe 50,000 or whatever, and then it's in addition to that, they have coverage over that in case it exceeds that, probably going up to 5 million. Is that how it typically operates? Yeah,
they have risk coverage. Since they're self-funded, they're at risk for those payments, for those benefits, because they're not fully insured. So they do shed some of their risk with other insurance. But our procedures are the planned medical procedures. So they're like total hips or total knees. Ones that they can plan. We do quite a bit of actually general surgeries as well, like gallbladder and hysterectomies and those kind of things. So we've been able to show 30 to 50% discounts off of their regular payments under their health plans for those procedures. So
you're basically a piece to the big puzzle of how they put together self-insurance.
Yes. I mean, what we do is offer the benefit. We're a supplemental benefit, so they still have their health plan, for primary care stuff and for urgent things that we don't cover. But if the employees come through us for the planned medical procedures, because of the discounts we're able to get with our bundled case rates, the employers actually, through their plan, waive the deductibles, the co-insurance, and the co-payments. So when the employees and their dependents come through us, they save between $4,000 and $6,000 themselves on the case, and then the employer again saves. The employer may save on, as an example, for a total knee. We see total knees. The employers are now paying around $40,000. We're about $22,000, and so of course the employer is willing to waive $4,000 for the employee to use us because of the discounts that they're getting as well.
So you buy knees by the volume.
Yeah, we do.
That's
You're
just
right.
ridiculous. Sorry about that, but you kind of put it out there. I couldn't resist. So,
you're right.
Let me ask you, how many employees do you cover altogether?
Right now, we have about 130,000 lives. And we've picked those up in the last 18 months. We just started picking up. Yeah, we just started taking on clients in November of 2011. So, but we're going to double this year and then probably double or triple in 2014. So we should have 500,000 lives in the second quarter of 2014 and probably a couple of million by the end of 15. I mean, this is
So basically Obamacare has been a bonanza for you guys.
Yeah, I mean, it's, we are going to, we're going to survive in spite of Obamacare because of the fact that there just isn't the transparency still in the market around cost. Nobody really knows if you've had a planned medical procedure exactly what your payment is going to be. I mean, the bills keep rolling in for 6 to 8 months, and when we send a patient, we know exactly, we've already negotiated the upfront cost, so we know exactly what it is, so there are no bills that keep rolling in. So we do think we'll be around, and we'll actually help those ACOs that are coming into play, because these employers, and we actually have a couple of large employers in the Houston market. We do quite a bit of business in Houston because of the petrochemical companies down there. But these employers have employees all over the country. So our 130,000 lives are anywhere from Washington State all the way down to Florida and up to Maine. So we've done hundreds of these procedures literally across the country in 35 different states.
That's just incredible. I think it's very brilliant on your part, because I think transparency is like the thing that people are most frustrated about, particularly business owners. Is it's such a weird leviathan that they go through when they're trying to figure out how to take care of their employees. Because most of them, they have the best intentions. They would love to be able to do that, but they always feel like they're being mugged.
Yeah. Yep. I mean, it's just hard to find it. They have the data, but it's just difficult to weed through the data. So we have a system where when they give us their historical data, we actually bundle their historical data. So we actually can show them, look, last year you spent $41,000 on a total knee for your 90 patients that went through, your employees that went through. Ours, with even a higher quality network, ours are only at 22. So you could save millions by sending your patients or your employees through us. And of course they get that immediately, right? Because they're trying to save money any way they can.
Oh, I love it. I think that's fantastic. All right, see, this is entrepreneurship at its best and at work, and it sees a need, goes after it, and you're obviously being greatly rewarded for serving that need.
Yes.
Yeah, you gotta love that. EDHC, that stands for Employer Direct Healthcare. EDHC.com. I encourage people to check that out. And what's a small company for you to work with?
A small company, the smallest company we're working with has 740 employees. And so they probably have maybe 1,800 lives, including the dependents. Our largest company is 30,000 employees. It's a top 100 company that's a national company.
Very impressive. That's even a bigger small town. That's
yeah. Yeah.
Well, I want to congratulate you. Are you one of the founders? I assume you are if you're only 2 years old and you're the CEO.
No, I'm not. Actually, the founder was very visionary, and is still involved.
He's on the beach somewhere, right?
Yes, I came in just recently, actually, to take him to the next level regarding operations. And my background is in the provider area, so I'm helping them develop their provider network. I've had about 26 years in healthcare, basically running physician practices and hospital-owned physician practices across the country. So I was kind of brought in to bring them up to the next level.
Love it. Thomas D Johnston, CEO for Employer Direct Healthcare, based in Austin, Texas. EDHC.com. Great segment. This is another example of your business owner. Don't get mugged. Look at options like this to really protect your business in a manner that really takes care of your financial situation as well. Thomas, I appreciate the great work you do. Thank you. Oh, and by the way, I want to put you on hold just for a minute after we let you go. I'd love to get your email. I'd like to chat with you some more. Thomas Johnston, he again is with EDHC.com. When we come back, more for you right here on The Price of Business.